when I start a shift now, we're exhausted, and we're also looking around like, who are these new people? In fact, where did that other person that was scheduled to work go? Well, they got Omicron, they got sick. And that's why we're seeing also the guidelines is changing, during mid-shift, where it was you get sick, you have to stay out for 10 days because you don't want to give it to patients. Technically, it's 18 to 20 days is the median time for contagiousness. But now they're making 5 days. And in mid-shift, now we're hearing from other parts of the world, in the developed world, that even if you're sick with Omicron, get back to work and put on 995, because the alternative is to shut down the healthcare facility because we are severely understaffed. And we're basically bringing all these new staff members who are getting a crash course in emergency medicine to fill up these spots. So it's really difficult to really manage this plateau, if you will. We have vaccines now. That's great. But it's kind of like old age. Like early on in the pandemic 2 years ago, we were fresh-faced. We were ready to fight this. Now we have vaccines, but we're also tired, right? It's old age. You were younger, you were fresh-faced and everything, but you had all this energy, but you weren't as knowledgeable. Now you're wiser, you're older, but you're also burnt out. So we're mortally injured.
I've got to ask you about Florida because it's a major hotspot right now. In just one day last Friday, the state set a daily record with more than 76,000 cases. So where are you in this progression? Are you at the wave stage? Do you feel like it's cresting? Do you feel like you're getting inundated? What's it like?
Yeah, I think we're really kind of at what we think may be the peak, but it's really hard to tell. But we're really, at capacity right now in terms of our patients and our staff that are getting sick. So it's not only that we have a lot of patients coming in, but we find that we're having fewer and fewer people available to care for them because our staff is out. So we've had to employ, similar to other places in the country, we've had to employ very creative solutions to try to keep the hospital staffed and keep those patients that are there well cared for. And that's getting challenging.
You've heard people on the front line talk about exhaustion, but they've also talked about something else called moral trauma. Moral trauma. You heard the healthcare workers say that several times. That's a very important concept, because what moral trauma is comes from the military. When you know your leaders have thrown you into a battle they never should have done. They send you against an enemy when you're unprepared. They haven't done what they should do to protect you, the soldier. Now we're seeing that very same phenomenon with our healthcare workers. We're not giving them the support we need, and you're hearing them use a word you've never heard before in general public, which is moral trauma. And you heard it 3 or 4 times tonight. And I think we have to reach out and understand what our healthcare workers are going through.